My name is Lindsay Sharp, and I am one of the infection preventionists for the Adena Health system. I started working at Fayette Memorial when I was in college, and I knew I wanted to do something in healthcare, but I wasn't sure what. I started as a med-surg nurse when I got out of nursing school, and I was a bedside nurse for many years. I then became a cardiac stress test nurse and did that for several years. That job was only part-time, so they asked me to take the infection prevention and employee health position. And then once we were acquired by Adena Health, I became full-time infection prevention. As an infection preventionist, we do lots of different things. Day-to-day work, we look at every patient that's in isolation and make sure that they're in the appropriate isolation. We communicate with the nursing staff and providers pretty much on a daily basis. We input a lot of data such as influenza, COVID, and RSV. We look at any hospital-acquired infections and do lots of chart abstractions. I think one thing that people will be surprised to know about infection prevention is that we work with so many disciplines for so many different processes. We work with our facilities crews if there's any construction projects to make sure that there's no dust in the HVAC system, that there are barriers in place to make sure that our patients and caregivers are safe. We monitor for Legionella, and we're part of that water management team with many other disciplines. We work with EVS to make sure we're cleaning the rooms appropriately with appropriate disinfectants. To keep up to date with the latest practices, we actually have a APIC committee that we are a part of, and that is the Professional Organization for Infection Prevention. What I enjoy doing in my personal time is basically anything outdoors. I love the nature. I like to work in the flower beds. I love to swim. We live on a farm, so we ride four-wheelers around the farm. I have an 18-year-old son and a 14-year-old son. We actually raise pigs, so we spend most of our evenings in the pig barn as a family, and I really enjoy watching my kids show livestock. I travel to all three critical access hospitals. All three of those are in rural communities. It's very important to have Adena Health care available to those rural communities. It's really nice to work in those locations that's small and see friendly faces from the community that you recognize come in the door and be able to help them with their day-to-day healthcare needs. The most rewarding part of my job, as I mentioned earlier, working with the other disciplines through the healthcare organization, is seeing those processes put in place that we have created with other team members to make sure that our patients and caregivers are safe.